Today we're observing World Stroke Day, and this year's theme is bringing stroke advocacy and awareness together to drive action. And the slogan is "Every minute counts." So I would like to touch on something that's very important. A lot of Guyanese, in general, sometimes we don't know how to recognize a stroke when it's happening, and oftentimes patients they come to the hospital a bit too late, and some of the complications that we could have otherwise prevent, they end up having to live a long life of disability. And I would like to at least impart what are the signs and symptoms, things that you can look for in somebody that might be having a stroke. So we like to use the acronym BFAST, where we have balance, a sudden onset of balance dizziness in combination with um, one of these other things. For example, sudden vision loss. A patient might be having, what Guyanese like to say, the face twisting on one side or it might be pulling on one side. The other thing is the arms and leg. They might be unable to move the one side of the body. And also very important, the speech. Persons might have a sudden onset of associated speech disorder. You would hear they would have a sort of speech that's slurring. They would like talk and like, "Ugh," and the speech, the words would not come out right. These combination of signs and symptoms, the person would have a high possibility of having a stroke. And for T, what we do if we see somebody's having a stroke, right away we call the ambulance, we get them to the hospital so we can help them.
The main risk factors for stroke includes hypertension, diabetes, smoking, and high cholesterol. We aim to improve patients' outcome with strokes and to prevent future strokes by advocating for management of all of these risk factors. In addition to the above mentioned factors, other modifiable risk factors can include things like alcohol consumption, unhealthy diet, persons not having enough exercise. There's some cardiac conditions also.
Stroke, as it is, still remains the third leading cause for death worldwide. It's basically where there is insufficient blood supply to the brain or a ruptured blood vessel that can cause a person to develop a stroke. Now, annually, 15 million persons are affected with stroke. 5 million of those persons will develop disability. 5 million will die, unfortunately, and 5 million will recover. So our aim today is to spread that awareness to bridge that gap between losing those 5 million persons and basically helping as much persons as we can in Guyana to decrease the amount of stroke patients annually.
When patients get to us and they already had a stroke, it's difficult because now is the years leading up to the stroke is when we should have been paying attention to our health, eating the right things, exercising, being active, being healthy, also following up at clinic, using your medications. All these things are important because preventing the risk factors or combating the risk factors is how we go about preventing strokes.
Every day, from what we have observed, is that quite a large amount of persons come into the hospital, both old and young persons affected with stroke. We've been getting a lot of younger persons now, and we're still investigating as to the reason why those persons are coming into the hospital with stroke.
What we have noticed over the past few years is that there's an alarming number of young patients with stroke, which is not something that we anticipate. Stroke in the young is not as common as stroke in the elderly, and it's becoming very concerning. Hence why we're trying to ensure that persons are adequately evaluated for their stroke and to identify their particular risk factors. Because risk factors in the younger population are not necessarily the risk factors that we would find in older persons, even though they can coexist.
Our main motto in rehabilitation is life does not stop after you have a stroke. So with rehabilitation, we have occupational therapists, physiotherapists, and speech and language therapists, right? With occupational therapy, what we're able to do is we're able to teach patients to function within their capacity. We work hand in hand with speech therapy that helps you to strengthen up after you have a stroke, because what you want to do is you'd want to be strong and healthy instead of lying down in your bed all the time. So to be able to sit up from a chair, move around, physiotherapy is really important through exercise to help you to regain those strengths in your body. With occupational therapy, after you get those strengths, we're able to help you to be independent as possible.